Hi, everybody. My name is Ryan Luquette, and today I will be discussing with you how race, being from a bilingual family and being from a military family, can have an effect on autism. Our specific objectives for today's presentation is for the audience to gain a deeper understanding of how people from different racial groups can have different experiences in getting an autism diagnosis and acquiring autism treatment. In addition, hopefully the audience will understand the problems bilingual families face when it comes to treatment and understand the unique problems faced by military families when it comes to finding steady treatment and social support. And finally, I hope you all learn some useful tips to help these families from different racial groups and families from a bilingual and military background, and these tips will just help you become a better service provider for everybody. Alrighty, so first we will discuss the racial differences in getting an autism diagnosis. On average, African American children tend to be diagnosed with autism at a later age than white children, and that statistic tends to be more along of 1.4 years difference between African American and white children whenever it comes to getting a diagnosis. And not only that, but African American children are more likely to be diagnosed with ADHD or a conduct disorder than autism on a first visit. And the result of this later diagnosis has an effect developmental wise because that is a pretty significant time gap developmental wise. And as a result of getting a later diagnosis, African American children do tend to receive important treatment later than their white counterparts. And there are multiple reasons for these differences. One of those being parents' understanding of autism and developmental disorders, which can affect how they discuss symptoms with clinicians. There's possible clinician biases, and that's just basically implicit biases that they could be possibly unaware of. And then there's possible symptoms between races. And this can be mainly just being unaware of what autism looks like in different races since a white population size has been the majority for the most part in autism research. Now we're going to discuss the effects of getting early intervention services. And some of the benefits of getting early intervention services include lowering challenging behaviors in children diagnosed with ASD, improved communication skills, improved symptom severity, improved IQ scores, increased chance of better peer relations because they learn those social skills and how to like functional communicate with their fellow children. There's a better chance of getting vocational training and employment in the future whenever they do become functional adults. And overall, it lessens the cost on society. And these great with these great things that early intervention services do for children, having a later diagnosis can greatly impact these effects. And that's the unfortunate reality that some African American children have. Here are some recommendations for practitioners and teachers whenever it comes to these racial differences in getting an autism diagnosis and overall treatment in general. And the first tip I have for you is promote community awareness on the symptoms of autism in the minority communities. I say this because promoting awareness makes parents more aware of what the symptoms look like and it allows better communication between the clinician and the parent. So that way the clinician has a better idea towards like what's really going on with the child. And that's key to getting an early diagnosis. The second tip is be aware of possible implicit biases towards minorities. And this can be completely unconscious that we have. So it's important to be aware because once we're aware, we are able to better combat these biases, and that helps us greatly improve our relationship we have with these families. And it could be and one of the ways you can combat this implicit bias is just stop and think how my decision may affect people from a different racial group. And the third recommendation is be aware how symptoms of autism may differ between races. And that can be done through research. And I say this because, like I said before, a lot of early autism research, what we base the symptoms on, is based on white children. So being aware of how it may differ can greatly enhance how you treat these children and how you can have a relationship with these families. So our second topic today will be about bilingual families, and right now I'm going to give you some statistics. First off, more than 50% of the world's population speaks more than one language, and this could be families speaking two languages or more. Our second statistic is there was a 158% increase between 1980 and 2010 in the United States for households for which the primary language was not English. And for the most part, this could be due to immigration. Because whenever immigrants do come to the United States, they bring their own language, and that helps create our language diversity. Uh, and our third statistic is that in the 2014-2015 school year, 13.8% of students who are identified as having a disability under IDEA were also English language learners. And this is a very significant part in this for us all dealing with children with ASD because 13.8% is a pretty significant statistic for us. Alrighty, so now we're going to discuss the problems facing bilingual families whenever it comes to autism treatment. There are some clinicians who believe that speaking more than one language at home can have a negative effect on language development in kids who have that have a neurological disability such as autism. And language minority parents are sometimes advised against speaking their native language at home. This can have major effects on how parents have a relationship with the clinicians because if a clinician suggests this, they are kind of implying that the majority language is more important than the heritage language. And if you know the importance of language and culture, you know that language is a major part of culture. So if you're promoting this idea of the majority versus the heritage, you're basically kind of saying that the heritage, that these families' original culture is less than majority culture. And research and policies do not support limiting heritage language and often find that bilingual students fare better than monolingual students developmental wise. But putting these policies into practice, there are some barriers, such as staffing qualified people, because what happens whenever you're in an area in which the majority of people only speak one language? And for the scheduling conflicts, sometimes there's not enough hours in the day to really focus on language development. And there needs in special education programs, so that's a pretty big problem. Here are some recommendations for practitioners and teachers for whenever it comes to dealing with bilingual families. Be supportive of parents using heritage language and the majority language while at home. By doing this, you are showing that you respect the family themselves. And that's what we want because it helps build a better relationship with the family, which just helps increase that which will just help increase the effectiveness of being a clinician or a teacher. Be aware of how important language is in terms of culture because, like I said before, language is so important in culture. And by realizing this, this importance, you're less likely to promote the idea of a majority uh, culture. And once again, this just helps build that relationship with minority families. And a third recommendation is when possible, try to use parents as implementers for intervention because this helps combat the qualified professional barrier that I mentioned in the previous slide. And it makes parents more aware about how important treatment is and they can see the differences themselves. And that helps greatly with parent buy-in. Our third and final topic we'll be discussing today is military families. So first, I'm going to talk about the stressors for traditional military families, and this includes all kinds of military families, not just military families with autism. So traditionally, military families are at an increased risk of stress than non-military families, and this could be due to frequent unexpected relocations. And some statistics find that military families are 3 times more likely to relocate than non-military families. And another cause for stress is being separated from one another due to deployment or training. And these separations can be extended to months in which a spouse or a child doesn't see their family member for that entire period. There's less stable social support because it's hard to find good social support whenever you're constantly moving. And there's less stable access to specialized healthcare. So some areas may not have access to important health care services that are greatly needed. And that can be from autism treatment or, say, elderly care, heart doctors, stuff like that. And children constantly having to change schools can cause great stress on the children because it's hard for them to make friends and stay stable. All right, now we're going to discuss autism in military families. In 2019, there were reports of almost 30,000 military dependents being diagnosed with autism, and a lot of these dependents are children. With a combination of an autism diagnosis, the stress of separation, and the lack of stable social support, military families are at a great increase of feeling alone and anxious. And having that initial diagnosis can it's in of itself be very stressful. And with the added effects of all the stressors that military families go to, it can be a lot for them. And like I said before, due to repeated relocation, there's difficulty finding appropriate treatment. And there are some areas in which the nearest autism treatment could possibly be over an hour away. So that can greatly affect if families can even get services. And finally, Stress of repeated moving and being separated from their family members can also affect how the child behaves. And this is greatly important whenever you're trying to do assessments for children whenever they do have access to treatment, because what the child's feeling now may not actually be an accurate measure of their behavior. It could just be a result of a temporary, it could just, these behaviors that you're seeing at that moment in time can be temporary. And we want to be aware of that. And finally, here are some recommendations for teachers and practitioners whenever it comes to dealing with military families. And the first tip I have for you is research military family support groups that specialize with having children with disabilities in your area. This helps create that social support system so that way these parents don't have to feel alone and anxious, and that will greatly and that can have potentially the effect of greatly improving home life, so that way parents feel like they're being better parents to their children. My second tip is provide a list of resources to clients, parents, such as therapy service, respite care, and counseling services. And this is just so that way the families are aware of the services in their location and they don't have to feel so overwhelmed with doing it all by themselves. By doing this, you're potentially helping increase the relationship you have with the family because it shows that you care about the family. And finally, make a note about the recent location or family separation when administering assessments to clients. Because, like I said, what the client is feeling at that moment may not be an accurate measure of what the behavior actually is. And we want to make note of that because it's not really fair to hold the client to those standards whenever they're going through a very rough period in their life. And by making that note, we can make the appropriate accommodations. Alrighty, so in conclusion for this presentation, hopefully you have learned that there are cases in which there is a racial differences, in which there are racial differences in acquiring an initial autism, autism diagnosis and acquiring early intervention. And this can be helped remedied by increasing community awareness of autism, increasing awareness of implicit biases, and knowing autism symptoms may differ between races. For bilingual families, hopefully you have learned that these families with a child with autism may feel pressured to suppress their heritage language, in which doing so also makes them feel pressured to suppress their own culture in general. And this can be remedied by promoting bilingualism at home, being aware of the cultural importance of language, and using parental involvement in treatment. And finally, I hope you are made more aware of the unique challenges faced by military families due to multiple relocations, extended separation, and trouble finding quality care and treatment. And I hope you have also learned that for military families, these barriers can be remedied by helping find specific support groups, providing important resources, and making accommodations when providing assessment to clients. And by following the tips and recommendations that I have given you, you are hopefully being able to be a more effective provider or teacher to these specific populations, because you're able to make more accommodations in which it can be more fair for everybody.